to show you tear in supraspinatus tendon. So this is supraspinatus tendon. There's greater tuberosity where its fibers insert, and look at the irregularity of the greater tuberosity. It's quite irregular, and these fibers that are inserting on this area, we can see some hypoequic area in that. This is due to injury, so it's a tear in the supraspinatus tendon at its insertion on the greater tuberosity. This is sagittal direction. So I'm looking at the supraspinatus in sagittal direction. I asked my patient to put his hand as if he's putting his hands in the back pocket of his pants. So that is a position to see supraspinatus. See? This is supraspinatus, and that is tear in supraspinatus tendon. That's it.